Well, Jeff Parker is joining us on the program, and you'll see that he's wearing his mask. I'm going to put my mask on as well. And we know that wearing the mask, I'm going to talk a little bit louder, has been, one of the key points and key contributors to keeping the numbers down, even though our numbers have been pretty high, especially here in Orange County.
We've seen, unfortunately, a big jump in the numbers, and what you see on the board is a reflection of a weekend total. So it's not just, but to give you context to that, 22,945, almost 23,000 COVID cases over the weekend. That last weekend, last time I was up here, it was 15,000. So
Wow.
we've seen a 7,000 increase full just on a weekend capacity. And we're up over we're averaging more than 6,000 cases on a daily basis.
Right.
So we've just seen this, as the country, as the state has, this big spike in COVID cases. And I think what we're seeing is also what we've always talked about, our concerns is the hospitalizations and the ICUs. We're up now to 964 hospitalizations. We were down in the 500s the last time we talked. So we're seeing from 545 on the 4th to 964. That's 400, almost 400 additional hospitalizations. This kind of a number is where they get worried about their ability to service people.
Correct.
You got people waiting in an ambulance or something like that to get a room. That's concerning.
Yeah,
and obviously the ICUs, again, they were in around 100 last time that we talked, and now we went from 104 up to 140. So 36 additional ICUs, which is not good.
And those are the numbers that we really need to look at, because the other people, they might have flu-like symptoms, but when you start seeing that hospitalization number go up like that and the ICU numbers to go up like that, and then the burden it's going to put on the hospital staff, we still have, unfortunately, car accidents and people getting sick and falling down and all the things that they have to deal with on a daily basis.
Exactly.
And now we see these numbers, that puts a large burden and stress on that staff.
And what's happening with at least throughout the state, and I'm sure it's in Orange County too, is that the staffing, as you just said, they're getting COVID.
That's right.
Because this is spreading so fast that you're seeing that impact to doctors, nurses, all the care people that are involved. And so it is putting a real stress on the environment out there.
They're probably the most vulnerable of any profession right now.
So obviously getting vaccinated, wearing masks, all those things are helping, but it's not stopping the spread of this COVID at this point in time. And so again, washing your hands, wearing the mask. One of the things that wanted to mention just in our local numbers, we went from 663 just last week to 726 cases here in the Laguna Woods area. So that's a big jump. Fortunately for us, the death toll in the community stayed at 60.
Okay.
So that's, knock on wood that we keep that, and hopefully our hospitalizations have. We know that Saddleback's been impacted, which is our closest hospital. So again, to our residents, one of the things that we emphasize is that the state has basically said wear a mask indoors. Wear a mask wherever you can, wash your hands, be safe, that type of thing. And being in social groups is least as amount as possible. And that's probably been the biggest struggle, because a lot of this increase in cases is really showing up from the holiday season.
Right.
And so you had Thanksgiving, we saw a spike. Then Christmas, we see a spike. New Year's, a spike. So hopefully, now that we've gotten past the holiday season and now back into, I'll call it the normal calendar, hopefully we'll see the downward trend starting in the next couple of weeks.
And it kind of tells you how strong this variant is, because I'm sure you had the same experience, but we all kind of laid low for the holidays, and most of my friends and family did the same thing. Unfortunately, my mom and brother didn't come over because it was too many people and we didn't want to chance it. And still, our numbers are pretty high. So, this isn't the time to, kind of push this aside. We need to get through this peak, and then it seems like talking to, hearing from what the CDC and other countries have already experienced, that, we probably have another 30 days of this at least, and then hopefully in March it'll start to slow down and get us into that spring and summertime.
And one of the things that the state has done is that the requirement for wearing masks indoors is been continued. It was originally January 15th that it was hopefully going to stop, but it's been continued another month at least, and they're going to reevaluate it in mid-February.
Right.
It's possible that that could be extended beyond that, which has an impact with regards to our operation here in the village as well, because we're seeing staff get sick or get COVID, whether they get really sick or not. The fact is they have to quarantine, stay away. So that's reduced, again, our staffing levels.
Right.
It has an impact. So we're juggling those things, and we'll continue to do that.
Yeah.
But really what we want to focus on is keeping people safe, keeping our staff safe, keeping board members safe, keeping our residents coming in. So one of the things that we instituted starting today, basically, is that we're going virtual with all our board meetings and committee meetings for at least till February 15th, and we'll hear around that time whether they're going to extend that or not.
Right.
So we'll follow the state guidelines with regards to that. But at this point in time, we're going to go virtual on everything. So there is information that we can provide with regards to how they can go look at the calendar, how they can get the information to download so that they can join the meetings.
Yeah, the easiest way to go is go to lagunawoodsvillage.com. You can see the calendar, and it says all governance boards, and that'll basically lay out the whole week for you. And then they can also go on Granicus. So we always publicize when we do our Monday memo and we talk about our meetings. You always see the website there. It's a / with Granicus. But that's still their way to participate and stay safe. And I think that's the most prudent thing to do at this time.
Right. Very important.
And then we also want to talk about resident services, because that was affected due to COVID. And, like you just mentioned, staff staff is being affected by this. And, if you happen to be on Nextdoor and you hear about staff not being able to do certain things, well, the bottom line is that a lot of the staff has been affected. Broadband has been affected. Our resident services now has been closed for walk-ins, and we're encouraging people to call them, and that's at 597-4600, and even email them if they have any work orders or anything that they have of concern. So, those are the kind of things that I think people don't realize. I mean, not only did we have a labor shortage, right?
Right.
And we're really
Already have
affected
that
by
problem.
that. Our HR department, those poor staff people can't find, they can find some people, but they're not. Some of them aren't qualified,
and
and
some
they're
of
hard
them,
to find.
some of it is just finding people, then training them.
Right.
With resident services, we were down 3 or 4 positions already, and we got hit with the scenario of some COVID going through.
Right.
A couple people getting COVID, unfortunately. And the problem is that if in a close proximity of working together, the requirements of somebody who could be in contact with somebody who got COVID, they need to self-quarantine until they get tested or they go past the 5-day period where they have no symptoms and everything, and then they can start looking at coming back.
Right.
So we're obviously using the capabilities of our technology to have people working from home. That helps. But the reality, that's why we had to shut down the walk-in relative to resident services, because we just didn't have the staffing.
Yeah, that was the best solution for them at that time.
And we'll get it back open as soon as we can.
Right.
That's our plan.
Well, speaking of things that kind of have been altered, the Mobility and Transportation Committee, they were supposed to meet on Friday on the 14th, and because of this, again,
exactly.
we're moving it out till next Friday.
So we are. We're so on the 14th was we were going to have informational meeting scheduled, and to talk about looking at a partnership with AgeWell and how that could possibly work. We wanted to have a conversation with our writers and people involved, but because of the COVID and because of the need to go virtual, we wanted to make sure that everybody that would participate or could participate can. And so one of the things that we kind of segued into is by moving it back a week to the 21st, the following Friday, we'll be able to be on TV6 and virtual at the same time. So people who aren't orientated to be on a computer, they'll be able to watch it on TV6.
Right.
And we'll be able to take comments from them via letters or emails that they can send after watching the program or why they're watching the program. And then obviously people that are virtual will be able to interact at that point in time.
Right.
Then after that meeting on the 21st, gather all that information, and then what we're going to do is plan for a meeting where we could have people engaged actually live, you know, which was what we were hoping for on the 14th. We'll now move that to February, and hopefully we'll get the state to say, hey, things are going well. We can take off the requirement for all of the protections that we're doing, and then we would feel comfortable, like over at Clubhouse 5 or Clubhouse 2, having an event where we can bring in, especially the riders. We want their input, but there are people in this community that don't ride now, but will ride in the future.
That's right.
You know, so we think this is a good opportunity, and we certainly want to have a full-blown discussion about it before we take any action. And I think that's the important thing. No action's been taken. This is really a discussion point at this point in time. We brought it to the GRF board. They said, hey, let's have that dialogue out there, and then we'll make some decisions down the road.
For some of us that are kind of new to this subject, can you give us a brief description as to the possible changes that are possibly going to affect those riders?
So with regards to our ridership program right now, we have the fixed route, and we have the journey route, and then we have the lift program. We'll continue to operate the lift program. What we were looking at was whether or not running the fixed route and the journey route could be better managed and run by AgeWell, which is a company that runs senior transportation services throughout Orange County. So that's what they do.
Right.
And they do it throughout the county, like I said, to a number of senior centers throughout. So that's their lifeblood, right? And so we're looking at, is there efficiencies in having them have this management responsibility? It would still be under the control and oversight of GRF and our General Services Department. It wouldn't be like we're just handing it over and saying, forget about it. No, this is a partnership. And we want to evaluate that. We want to look at the advantages of that and talk to the residents who ride and get their input on that. And then we'll make a decision whether or not that's good for us.
Right. Well, it's interesting. I bet you if you look at the routes in AgeWell, they're going to the same places the same time our bus service goes. They still go to the hospitals, they go to the shopping center. We see them riding around, you know, in our community or surrounding community. And it would probably be a smart thing to kind of combine those routes and get less buses on the road too.
And one of the things that we really want to emphasize in our, we'll show this in our approach, is that our fixed route system's not going to change. They're just going to operate it, but they have some efficiencies in how they have their own dispatch and stuff like that. So there's efficiencies there. They're going to take our employees that are our bus drivers right now, and they're going to incorporate them into their programs. So it's not like it's a major change. It's just really who can manage it better and more efficient, which would be the benefit to everybody.
Right. Well, it sounds like a great opportunity for our bus riders to have some input. And like you said, next Friday on the 21st is your time to kind of get some information and do a little bit of homework and talk to your fellow bus riders. And then it sounds like possibly in February we'd have more of a town hall kind of discussion regarding that transportation option. And you would all make the best decision for the community. Well,
exactly. So 9:30 on the 21st.
Sounds good. Be sure and watch Village Television. We'll have it live. And of course, you can always email your comments and be a part of that discussion. If you don't want to be through Granicus, you can always email us, and we will get those questions to staff and to that committee as well.
Great.
Well, thanks so much for joining us on the program. It was great to see you, and enjoy. Well, you have the United Mutual Board. If you're watching our program live, that's going to be on in about 20 minutes, and you'll be a part of that as well. Thank you so much for joining us.
Thanks, Paul.
That's Jeff Parker. He's our CEO of Village Management Services, and he usually joins us on Tuesdays. So be sure and tune in on Tuesdays, where he gives us not only some COVID numbers, but also very important information regarding what's happening in your community. We're going to be right back with Lisa Hart with 2022 New Year's resolutions.